Internationally, as a surge of COVID-19 infections spark severe shortages of medical oxygen in hospitals, desperate patients are flocking to a tent outside a Gurdwara, a Sikh place of worship. Patients have been left to fend for themselves. For many, it's a slow and gradual road to death.
It's a grim situation across all India, but the western state of Maharashtra and its capital Mumbai have been hit especially hard. As record infections spark severe shortages of the gas in hospitals, desperate patients are flocking to a tent on the outskirts of Delhi. People stricken with the infectious disease gasp for breath as they lay on benches and in the back of rickshaws. Priyanka Mandal said she wasn't able to get her 55-year-old mother, who suffers from diabetes, admitted to a hospital after her condition deteriorated. She eventually found someone willing to sell her a cylinder and 6 kilograms of oxygen for 30,000 rupees, equivalent to 40,000 shillings, far higher than usual market prices.
It has taken 2.5 hours for me to commute from my place and come here for this oxygen, so I cannot take back her without an oxygen. So I have to give it to her no matter how much time it takes. I have to wait here.
The World Health Organization has estimated that about 1 in 5 people with COVID-19 suffer from respiratory distress and need oxygen therapy. India has recorded 2.3 million fresh infections in the past week. In Delhi, the worst-hit city, around 20,000 to 25,000 cases are added every day. Patients have died outside hospitals, gasping for air as they wait to be admitted. In some places, even those who managed to get in then reportedly died due to the facility's low oxygen supplies. Some families said on social media that they were asked by hospitals to source their own cylinders. Twitter and Facebook have been flooded with frantic appeals for places to buy tanks and refills, often alongside readings of dangerously low oxygen levels in the blood. Volunteers fan out to other cities up to several hours drive away, looking for places willing to fill the cylinders. The site had several tanks on Monday, but on Tuesday, as night fell, it was still trying to refill its empty ones as it supplied oxygen to waiting patients via an oxygen concentrator which produces oxygen from ambient air.
It's certainly a very devastating situation there in India. We pray for better times.